Hello, my name is Carlos Bloom, and today we're going to talk about bladder endometriosis. First, we need to define what is bladder endometriosis. Endometriosis is a condition where tissue resembling the uterus lining grows outside the uterus, such as on the ovaries or fallopian tubes. With bladder endometriosis, this tissue grows inside or on the surface of the bladder. Bladder endometriosis is a rare form of the condition that can cause severe discomfort. When it forms only on the surface of the bladder, it's called superficial endometriosis. And if it develops inside the bladder lining or wall, it's called the deep endometriosis.
Hi, my name is Mr. Faris. I am a consultant gynecologist working at the Lister Hospital in Chelsea, in London. Endometriosis is a common gynecological problem affecting women of reproductive age. This can affect women of any age, but is most common in women in their 30s and 40s. 1.5 million women in UK are currently living with endometriosis condition. It is a long-term condition and can have significant impact on the woman's life. Endometriosis is a condition where tissues similar to the lining of the womb start growing in other places, such as the ovaries, the fallopian tubes, the outer surface of the uterus, the inner lining of the pelvis, or on the surface of other organs in the pelvis. Each month, these are cells that react in the same way to those in the womb, building up and then breaking down and bleeding. Unlike the cells of the womb, that leaves the body as periods. This blood has no way to escape and irritates the site where it's attached to, causing pain, some tissue reactions in the form of inflammation, and scar tissue formation. Symptoms of endometriosis can vary. Some women are badly affected, while others may not have any noticeable symptoms at all. Heavy periods could be presenting symptoms, pain in the lower tummy and back pain, usually worsen during the period pain that stops women from their normal activity, pain during or after intercourse, pain when passing urine or opening bowels, especially during the time of period, difficulty in getting pregnant due to the inflammatory effect and the mechanical obstruction and the scar tissues that are formed by the endometriosis reaction. It also can affect the fertilization and hinder implantation in itself. Endometriosis can be diagnosed by ultrasound scan, which can be helpful especially with ovarian cysts, but can miss other sites of endometriosis. Laparoscopy, which is a keyhole surgery, is the gold standard for diagnosing endometriosis. It could be also used for treatment of endometriosis surgically. Treatment of endometriosis could involve treatment of symptoms, including pain management, painkillers, using a coil that contains hormones that decreases the flow of the period and subsequently decreases the pain. Contraceptive pills can also be used to minimize the symptoms. Surgical management of endometriosis involves removal of endometriosis, release of scar tissues, and removal or excision of cysts that are on the ovaries, but this has got to be large size and fulfilling certain criteria. When approaching surgical management in view of fertility plan, the surgeon must put in consideration minimizing any risk to compromise the ovarian performance, especially when we are removing cysts on the ovary. Assisted conception in the form of IVF can bypass most of endometriosis problems. Hysterectomy, which is removal of the womb and the ovaries after completing the family, could be the definitive treatment.
Now, to talk about the applications in medicine, symptoms include feeling the need to urinate urgently, frequent urination, pain when the bladder is full, burning or painful sensations when passing urine, blood in the urine, and pelvic pain. Diagnosed methods include the check for any abnormal growth of the bladder, urine exams to detect any blood, perform an ultrasound, perform an MRI scan, or perform a cystectomy, which is the insertion of a scope through the urethra, as is going to be shown in the next video.
Your doctor will perform a cystoscopy to diagnose conditions of your urinary tract. Your urinary system or urinary tract produces urine and excretes it from the body. It includes the kidneys, ureters, bladder, and urethra. In men, the prostate gland wraps around the urethra at the base of the bladder. As blood circulates, it passes through the kidneys, where wastes and extra fluid are removed to create urine. The urine then moves down the ureters to be stored in the bladder, an expandable balloon-shaped muscle. During urination, urine leaves the bladder through the urethra and is expelled from the body. By allowing your doctor to view the interior of the urethra, bladder, and the openings of the ureters, a cystoscopy may reveal the following conditions: an unusual growth such as a polyp, cyst, or tumor, a stone in or near the bladder, chronic inflammation or infection, a stricture or narrowing of the urethra, enlargement of the prostate gland, or ulcers in the bladder wall. Before your procedure, an IV line may be inserted into your vein to provide medication. Your doctor will begin by applying a local anesthetic to numb the area. Once the area is numbed, he or she will gently insert the tip of a cystoscope into the urethra and slowly advance it up into the bladder. The end of the cystoscope contains a light source and lenses, which project images through an eyepiece and onto a video screen. By introducing a clear, sterile solution, your doctor will expand the bladder. He or she will carefully examine the lining of the bladder and urethra by looking through the eyepiece on the cystoscope, as well as by viewing images projected onto the video screen. When your doctor is finished, the scope will be removed. Your doctor can tell you what was seen immediately after the test. If a biopsy was taken, results are usually available in a few days. This procedure usually lasts about 2 to 10 minutes. You will usually be able to go home soon after your cystoscopy. Your doctor will likely prescribe antibiotics to prevent an infection and may offer you medications to treat any lingering discomfort.
Now for the pros and cons. For pros, we have the bladder endometriosis has a low mortality rates and is treatable with a laparoscopic cystectomy, giving good results. The cystectomy is a procedure in which they remove a part of the bladder. Now, to talk about the cons, in more advanced cases, total removal of the bladder will be necessary. This is a total cystectomy. A complete cystectomy the bladder endometriosis could lead to a stage 4 endometriosis, which means that there is going to be growing of this type of tissue inside several of the pelvic organs. Now, to talk about this issue in Ecuador, in a study during the surgical sterilization, between 2 to 18% of the women had endometriosis, and between 5 to 50% of this caused infertility. This related to the endometriosis. 70 to 85% of the urinary tract endometriosis are associated with the bladder. In conclusion, we have that bladder endometriosis is not reported to have a great mortality rate, but it may cause a lot of complications such as an urgent or frequent need to urinate, pain when the bladder is full, burning or pain when you urinate, blood in the urine. If not treated, it may lead to more severe complications such as kidney damage, cancer, or infertility. Thank you.